Tell me what you see when you look at me. Do you see another brother lost in these streets looking for his soul?
Trying to find my soul.
Or do you see another brother searching for lost souls in these streets? A street soldier.
Street soldier.
Here to help you get that chip off your shoulder, warm your colder days and sober your drunken ways, and find a way to help you get over these hurdles placed in our path. And this is not meant to amuse you. This is for all those who have questions but are afraid to ask.
I won't be afraid. I won't be afraid. No. When times get hard, you lose your way. Open your mind and hear what I say.
This is a message for the hard and the soft. To those who tune in weekly and to those who keep an eye out for 8 p.m. on Sundays and turn their radios off. The truth hurts. The cloth has been pulled. We're walking around half dead. Use this show as your IV. Alive and Free is a new movement. We've achieved self-destruction. A street soldier promotes self-improvement.
Streets couldn't be no colder, so I gotta be a soldier. It shouldn't be this hard for me. Even when it seems so hopeless, I gotta keep my focus. I'm glad to be alive and free, yeah. Streets couldn't be no colder, so I gotta be a soldier. It shouldn't be this hard for me. Even when it seems so hopeless, I gotta keep my focus. I'm glad to be alive and free, yeah.
All right, we're going to now speak to this particular guest, and I saw his face for a minute, and then there he is. What's up, Doc? Well,
I like that background. You got that background working.
I had it on for a minute. Yeah, I had to let me go. I figured I would go real now.
Doc, thanks for
How you guys doing?
Oh, we're doing as well as we can. Let me tell everybody, this is Dr. Andre Campbell, Professor of Surgery, and at UCSF or Zuckerberg, and hospital in San Francisco, and Vice Chair for Diversity, Equity, and Inclusion at UCSF, among a whole bunch of other things. But for us, he's a great friend of the show. He's a great friend of young people. He and I are brothers in an organization. I always wonder if I can actually say that live, brother. I got
one point it was secretive, but
it's a secret. Okay, all right. I'm not gonna say it now.
Straight, Dr. Campbell. Gotta keep him straight.
I got it.
Well, I ain't worried about him. Y'all be somebody. You can't say that. Yes, I can, but I'm not. All right, okay. Because I want to focus on the most important stuff here. And you've been on with us a couple of times in your work, with violence, trying to do something about violence. And the last time you're on, you gave us your expertise on the coronavirus or COVID-19. I'm going to read something to you real quick, and I want this to sort of set the tone for what we're going to do here. And I'm actually going to refer to this article later because I think it's a really good case in point for what we're talking about here. But it says here, health systems and public agencies rushing to address vaccine hesitancy among Black people must first acknowledge their own role in creating and perpetuating mistrust. The goal should then be, in partnership with Black people, to create forums for conversation and opportunities to have questions answered in non-judgmental ways by, and here's the most important part for me, by trusted messengers. So Doc, you're our trusted messenger. And I mean that. I mean that in every single way, because there is a lot of, historical mistrust. There's a lot of current mistrust. A lot of, I don't know what to believe. I don't know what's true. And you do need a trusted messenger. And you are that for us. I would easily say our community, and probably for a lot of people. And so we're going to try and put it all on you to answer all questions that people have. And you might want to say right away, I know the soul has some questions about uh, about the vaccine, about COVID itself. And Ann, you might want to say to the chat room, if you have any questions, because a number of people who said they'll be tuning in, to write their questions down, and we'll try to have Dr. Campbell answer them. But if I may, let's sort of organize this, and then I'm gonna let you introduce yourself, of course, into three topics. All right, and let's start with the status of the virus itself. Where are we?
Okay.
I just saw something with that, and let's sort of clear that up for people, and then we can move on to once we do that, the variants, because there's a lot of talk now about the variants, the new strains that are coming out, and then the biggest thing I guess we want to cover tonight is the vaccine itself and what's going on there. So, with that and that outline, Dr. Andre Campbell. Oh man! And first, one more thing. Our kids love you. Like every time a kid says you, they say, "Can I be an intern? Can I follow him? Can I do this?" Because every year you see our young people, and I know Mrs. Someone, as always, thanks you for that, and I will too. So you got it, Doc. Thank you again.
Well, first of all, Dr. Marshall and everyone else, thank you for having me tonight. It's always great to see my friends. It's just great to be on your show to talk about a lot of different things. And tonight we'll talk about COVID. And it's always great having your kids over at the hospital. Doing it virtually. It's better to do it in person, but I like but we're in the virtual space now, which we are now. I was looking at the picture you sent out for the advertisement. It was like the last time I was in the studio and what that was like, and I thought that was pretty cool to do that. So let me just start off a couple of things. Is that we're now 1 year in the biggest pandemic of 100 years. So 1 year. So 1 year ago, first case was found actually in Santa Clara when somebody came in with that. As it turns out, when they backtracked it, it was probably in the United States. Before that, it originated in Wuhan, China, which I think everyone knows about this. So we are now at, just to give you an idea of where we're at, in the United States, we're at 25 million cases. We're at 417,000 people have died from this virus. In California, we have the most of any state, more than other big states like Texas and Florida and New York. We have 3 million cases. New York has 1 million. New York has about 42,000 deaths because of all the things that happened before. We have 36,000 deaths. We're catching up because of the outbreak that we have. So in San Francisco, we have about 30,000 cases. We have 278 deaths. So roughly about 300 people died in San Francisco. So we're at about a rate in California, about 22,000 cases a day. We have a positivity rate about 8%. So a lot of numbers, but just to give you an idea is that number of cases per day was in the 40 to 50,000 range just a couple of weeks ago, and now it is about 22 or 23,000. So that is good. The highest, I think, the reported was in January 8th, where we had 47,000 cases in California. So you probably know that in Southern California, 1 million people have it. It's estimated 1 in 3 people are infected. The epidemic or pandemic down there is bigger because of a lot of reasons. People, several generations of people live together. Where people work is a big thing. They actually just did a recent study of looking at who got it and how it was transmitted. They found that people were cooks, people who worked in construction, people who worked in factories were at increased risk of getting a lot of that stuff that goes on in Southern California. That may account for why the demographics or why the numbers are a little bit different in Southern California than we have here. So that's kind of where we're at today. I mean, we have a little ray of hope. We're talking about who was in the hospital. We had 132,000 people in the hospital a couple of weeks ago, and now we're about 110,000 people hospitalized. Our ICU capacity in San Francisco is better than it is in Southern California, probably about 8 to 10%. We do have beds at our place. Just to give you an example, at San Francisco General, Zuckerberg San Francisco General, in the spring when we have our big increase, we had 45 patients, and more recently, we've been up to about 70 patients in our hospital, but about the same number in the ICU, about 13 in the ICU or so there. So we've made adjustments, and we know about surges, and we've had a lot of practice in doing that. And we have adequate beds right now to take care of the people who are coming to us who are sick. And the numbers, at least in the last day, have gone down. So that's sort of encouraging. I think that we may be sort of going through. The thing we were worried about is a surge and a surge and a surge. So
Right, right, right.
Thanksgiving, right, there was a big surge because everybody went home when they shouldn't go home, right? Right. Everybody's like, I got to go home and see mom, and then of course, then generations of people got sick, and then here comes Christmas, and then so between Christmas and New Year's, 14 million people traveled who shouldn't have been traveling, right? Now that's half of what we had a year ago, and maybe less. Than we're about 30 or 40% of who's traveling now than we had before. So it is less than it was normally, but it's still way more than there should be people moving around because the gold standard, even that, and I'm going to talk a minute about the vaccine in a second, and the strain and what have you. So just remember, viruses are built to mutate. So when they tell you that they have the terrible strain in England, one from South Africa, the one from wherever, right? That is how these viruses are built, right? They are built to mutate and to change, right? That's why we've never been able to get a vaccine for HIV because it just changes shape and you can't get a vaccine where we went really super duper fast to do this. Now, I got to say a couple things to the community because this is very important. Is that I'll say first is that I have taken the vaccine, and there are two vaccines available. One is Pfizer, and the other one is Moderna. Right? Pfizer is the one that has to be super cool, and I took it, and I had some soreness in the arm the first time I took it. The same time, the second time I had the same thing. I didn't get any other things. The things that people complained about is some muscle aches, headache, chills, fever. I never got any of that stuff. And actually, I did something stupid. I took the vaccine and I spent the night in the hospital. And that was really dumb, right? But but it wasn't a big deal. And I got through it the first one. The second one, I took time off just to make sure it was okay. And I didn't really have any problems either one. So I'll just say the vaccine is safe, right? So number one.
So
Go ahead.
before you go there, let's backtrack a little bit on the state of the virus. You're right, the surges, right? So I don't know where we are in the right now. Seems to maybe week by week. President Biden had said we'd hit 400,000. I mean 500,000. Then I saw another headline that said we'd hit 600,000. Now,
Yeah.
is that because? Where do those predictions come from? Is it just that so many people who get infected? Is that based on a percentage of them are going to die from it?
Yeah, so there's a lag between us. So what everybody's worried about is that January being the worst of all the months, right, of the whole pandemic, and that's really what we have. There'll be ups and downs, and that's what I'm kind of going through is the ups and downs. And the reason why, let's just go to the heart of the matter, right? Right, there was a major failure by the prior administration with not having a national vaccine policy in existence. That was a massive failure of biblical proportions, right? Where there was no national policy. It was like, yeah, just give it to the states and have them do it. Now you have to have a national policy. You have to invoke this Defense Production Act so you can have massive production of the vaccine. You can have more masks, right? You can have all the stuff you need to fight the pandemic because this is the things you need to have. And we never had a national policy until last week, right after President Biden took office. I know you guys were talking a lot about that, but the biggest thing that we're going to have now, we're going to have a national policy, and we're going to have to spend some money. We need to, right? The good thing is that today or yesterday, they vaccinated 1 million people a day, right? And right in the whole United States. And that is actually fantastic, right? But if we're going to get to this herd immunity where we can basically vaccinate the majority of folks, 230 million getting 2 vaccines, right now, as of today, probably about 20 million people have gotten the first vaccination. 2 or 3 million people have gotten the second vaccination. And what they're trying to do is vaccinate healthcare workers first, first responders, then they get to elderly folks, people inside of nursing homes who had a had a big problem. But the problem we have in the African American community, and I'll just address this specifically, is there's a lot of vaccine hesitance in the African American community. That's because the background of this is that people don't want to be experimented on because of Tuskegee study and other things where we see that there's a disparity in terms of outcomes and how things go. So that there's more hesitancy in the African American community than any community, because they're like, well, I don't want to be experimented on. I don't want to take something that's right. It came too fast. The reality is that the science basically drove it to where it's at. And there was actually an African American virologist who helped develop the Moderna vaccine, right? So a Black woman was involved in the development of one of the vaccines, right? So Kizzy, I think her Kizzy Mack, I forgot her last name now, but she's a virologist who's a PhD, and she spent time working on it. So I just want to say it's safe, and people need to take it, because the only way we can get out of this whole thing is for people to get vaccinated. And there's been some people saying, well, I don't want to take it because I'm scared, I'm nervous, I don't want to be experimented on. And like I have to say, I take it, I'm a fine, right? A lot of people I know have took it, and we're relieved, because now we have, after a 3-week period, we'll have antibodies against this terrible virus. Now, remember, the vaccine will make it so that you don't get sick and die from the thing, and it has 95% efficacy, which is great, right? So, but you still can get it, and you can transmit it, but you're not going to get it bad, right? And that's really that's what the message is to do it. We're trying to get this thing so it is manageable, right? And that is, right now it's out of control and it's not manageable. And we didn't have a national policy. Now we got a national policy, money's going to be allotted, and we're going to make sure that places like City College, the SF Market, and Bayview, right, will be giving out vaccines. And they were talking about the Chase Center doing it. There's all kinds of other places, Moscone, where people can roll in and get mass vaccinations done, so that we can get it done with doing.
Yeah, you feel, I'm probably saying the obvious because you said so already, confident that the Biden administration will tackle this problem in a way that it should have been tackled all along, and will give the maximum effort to doing something about getting, number one, defeating, I don't want to say defeating COVID, because I don't want to say it like that, but getting vaccines out to people. Because when we all know that, I mean, he said it was going to disappear. I can't say the person's name. And he said you should, inject bleach, and he didn't really care. I mean, he didn't care at all. That's the way a lot of us feel. And
true. Because,
so you're
you know,
yes.
who was the effect, right? Right.
Yes, right. Of course.
Dying,
Yeah,
right.
So that's good to hear. I mean, that all signs I see and everything that they have said, and it's like, look, we're going to do this thing right. And what's that Defense Act that should have been enacted a long time ago to deal with it on a national? I guess the main thing everybody couldn't figure out is it wasn't attacked nationally. It wasn't dealt with nationally. He left it up to the states. It was uneven and so on. And it made no sense at all, because the virus is saying, all right, well, we get anybody anywhere. So
the virus does not see color. It may attack us, African Americans, Latinx, Native Americans more, and it puts us in hospital at higher rates, kills us off at a higher rate. So 1 in 750 African Americans have actually died in the United States from the virus, right? So this is a very big problem with this. So the things that we'll still have to distance and mask up and wash hands and do all that stuff and not travel, right? Until we get enough people vaccinated, and then we could basically start to back off on all the things. But it's going to take a little while to do that, because we basically, Operation Warp Speed, they're not going to call it that anymore, because it was a lie, right? So it was not. It was a total lie, right?
Yeah, and I'm in fact reading his article. So I know you want to, jump in anytime you want to ask something. But one of the things I've heard is, and it's interesting to me, because people are saying they're almost penalizing, and that's not but that's the word I'm going to use, penalizing the scientists for moving what they feel quickly they say, we need a vaccine, we need a vaccine, we need a vaccine, we need a vaccine. And then we got a vaccine. Now, true, part of it is that well, Trump was saying that, and we can't believe nothing he says. But but then they're saying, well, it couldn't be good because it was too fast. And so it just, when I hear that, we were saying, we got to get a vaccine. We got to get a vaccine. So we developed one, and people are skeptical of what they call the speed that it happened. Can you comment on that? Because I don't know if there's a lot that went into this. Reading this other article, they said there was a lot of research that went into it and trials conducted on it. And you know more about that than me. So let's just talk about the development of it.
So right now there's two vaccines that are in circulation. One is Pfizer, which came out first, and the second one's Moderna. That kind of came out, around the same time, and that's what people are getting. There's a third one that's going to come out, Johnson & Johnson, right? That'll be a one-shot vaccine, and that's good. They're looking at data on that in a couple of weeks. So the process is the virus is sequenced, right, which happened in February, March of last year. They sequence it, so they're like, this is what it looks like. And then what happens, they develop techniques to attack the virus, right, so that what it does is it triggers your immune system so that when you get infected, it basically turns things on so that you don't get the virus, right? So it's sort of like, that's what the vaccine does. That's how our vaccines work, is it turns on the immune system so you can fight things off. And that's how, it's been done for a long time. And I got to tell you a story about a vaccine that happened in the 1940s, right? Just to kind of let you know about how we can do things fast if we need to. And I'll come back to that in a little bit. So what happens is we identify it, right? We then develop the vaccine. The vaccine then is tested on 40,000 people, right? All different shades. At first, they had problems getting African-American folks to volunteer to do it. What they did, and they found out that the vaccine was safe and effective. Most vaccines are effective about 65%, 70% of the time. These two vaccines, both Pfizer and Moderna, had about 95% reactivity against the virus. So that's actually really great, right? So what happens is this data comes out, the company does it, and then what happens is once the company does it, runs the studies, right, then it comes to the FDA, and the FDA then has a committee of experts that look at it, Food and Drug Association, and they say that it is safe and what they said is reasonable and that we can use it. So it goes to multiple phases, and all that stuff happened pretty fast, but it was done safely, it was done effectively, and it was signed off by the scientists who do this 24/7. So I think that's the thing that everybody's word is fast. It was fast, but it was safe, it was tested, and it was found to work, right? And that's the main thing with doing that. Let me just tell you this. There's an interesting story that I read just a couple weeks ago, and I want to share with us. So in the 1940s, about 1947, 48 or so, someone got on a bus in Mexico, took the bus to New York, and spread smallpox to New York City, right? And what happened is in New York City is they basically went on a mass vaccination thing, and they vaccinated, within 1 month, they vaccinated 6 million people with the smallpox vaccine, right? This is 1940s, right? So if they could do that in the 1940s, right? Here we are in 2021, right? We should be able to do that, right? And I think when you have competent people who know what they're doing and have done it, so the people who are running this ran the Ebola crisis that happened when Ebola came out. They had experience with H1N1, right? They have experience with these viruses that come, and they actually stopped Ebola in Liberia, which it would have come here, it would have been a major problem, right? But they stopped it in an under-resourced country. So these people know what they're doing, and they can actually make a big difference, and they could save us, which is what you want.
The attack on science, throughout this last has been, I would assume, some factor in this. It's just been like never before. How much do you think of a factor that has played, or does it play just? I mean, usually when your doctor says something, but he was discredited. Fauci in particular was so discredited. Science was so discredited during the past administration that, I mean, had to just, it's almost like it put doubts in people's minds over what you're saying, that, you know, it has been worked on by thousands of scientists, and it has been in the, I read a quote here that said the Moderna mRNA technology behind
mRNA
MR
vaccine
had been under development for decades. That it went through, like you say, 3 clinical trials and approved by, you know, FDA and the Centers for Disease Control, and this Black scientist at the heart of Moderna's vaccine development in her lab was powerful. This particular person, knowing that it was her, meant a lot to him.
Kizzy
Meant a
Corbett,
lot
I think
to
is
the
her name.
doctor. But is this the attack on science in general have something to do with this, that you think?
Yeah, I mean, well, first of all, it's the attack on truth, right? So let's just back up a little bit. It's
Thank
the
you.
attack on truth.
Thank you, all of you out there who believe
You
the
know,
election was
and this
stolen.
whole
That's an
business,
attack on truth. Go right ahead.
you know, or alternative facts, right? Those are the things that they were talking about, right? So I think, I hope I'm not breaking up. Can you guys hear me?
Yeah, we got you.
Thumbs up if you can hear me.
Yeah.
Oh man, maybe it's. Hold on a second. Can you hear me? You can
Yes.
hear me?
Yes.
Yeah, good. Yeah. Yeah, I just want to make sure my internet was acting up for a minute and I lost you. So let's go back. The attack on science is terrible, right? There are real facts, and we got to follow the science, and that's what Anthony Fauci was talking about, you know, doing. And I think, you know, if you see how he is now and how he is before, how he had to be before, when he was being attacked all the time, you can see that the guy's amazing. This guy's been through 7 presidents, right? And
Yeah.
the fact that, you know, he knows how to handle people. And I just love the fact he would get up there and contradict, you know, President Trump or past President Trump or former President Trump. I love the sound of that, right? So, right. He would just tell him that that's wrong, right? And that this is not how it goes. So you follow the science, you follow the facts, and you know, you have to also realize that there's a big anti-vaccination movement in the United States, right? It's huge, right? Actually, the highest percentage of unvaccinated kids are in Marin County, right? Which I hate to say, right? But so what happens is that we have to convince people that this vaccine is safe, it was thoughtfully developed, and we need to take it because we got to get out of this and get past this. And the only way we're going to get past this is having a large percentage of people, 70%, 80% of people vaccinated against this virus, so we can go back to how it was before. Look at what happened in New Zealand, right? A friend of mine lives in New Zealand. Well, a friend of mine has family in New Zealand. He's showing me pictures of New Zealand. New Zealand they live like it's a normal place, right? Nobody wears masks. There's no, you know, incidence of infection. I mean, think about this. The United States has 3% of the world's population, right? And we have 25% of the world's deaths, right? So 3% of the world population and 25% of the world's death. And that's because this whole thing, it became so political. And 100 years ago, there was people against masks, and you know, when they had the 1918, you know, pandemic, there were people against masks and people against science and all that stuff, you know, back then, you know. But you know, we need to make sure that we do things differently so that we can get past this. So science, we got to follow science, trust people, and we have to go forward because everybody wants to go back to how it was before this because nobody likes staying home, right?
So that's the door. That's the doorway to that. What I'm hearing, and you know, it's not hard to hear.
That's right.
The doorway to quote normalcy is this vaccine, is the vaccine. But a lot of folks, for a lot of reasons, are reluctant. And I would say the word reluctant to take it. And I know, so you had a bunch of questions, but the key thing is getting through this, whatever it is, fear, distrust, ever to get to the point where we can get back to what everybody wants, which is some normalcy. And because obviously you as a physician that saves lives, that's your number one goal. That's your number one goal.
Well,
That's what you
want people to live, you know. I mean, it's terrible when people, I mean, all these folks are dying. I mean, think about the amount of death that we could have prevented if
Right.
the whole mass thing was political, right? I mean, here I gotta say, like, this thing should not be political, right? This is on a surgical mask that people wear. I mean, this thing should not be political at all, right? And it should be, so wear a mask, protect people, protect me, protect you, protect your family, right? Let's go on about it. It shouldn't be like, there's massive fights, people are doing that. I'm just happy to find that airlines are starting to fine people for not wearing masks. They throw them off the plane. I mean, there's things that they got to do, right? Because we have to have one uniform way of doing this so we can get past this, right? It can't be like you're taking my rights away. It can't be that. It's got to be, this is not political. This is public health, right? Until we can get 70% of people vaccinated, we still have to take precautions, right, to make sure that everybody is safe, right? And that's really what this. If you think about a public health thing, that's how we have to do it.
I just got a text today before the show that someone 47 years old died of COVID, and he was in relatively good health. The text says, and what the person saying, please mask up. The next step would be please get vaccinated. And I but it's an individual thing, but it's good for all of us. That's what it sounds like. It's good for, we get, and when I hear this, 70% of the population, 80% of the population, if we get to that, so yeah, I'll let everybody, just sort of laid out there, but it's an individual decision. So I know you had a bunch of questions maybe you wanted to ask anybody in the chat. Maybe Doc can help you through it. How you feeling, what your thoughts are. He said he's taking it and he's recommended it.
Hey, Dr. Campbell, thanks for joining us again. This is Malcolm. Nice to see you again.
Hey, how are you? Good to see you.
I'm well, thank you. I got a couple questions. Hopefully you can answer. Number one, can you kind of just explain how the vaccines work?
All right. So what happens is you get it, like this is how vaccines work in general, right?
Mm-hmm.
So they go on you get put in your arm, and basically what it does is it turns on your immune system, so your immune system is exposed to something that looks like the virus, right? And what happens is your body then turns on a response to do it. And that's how this all vaccines work. So this one is messenger RNA, but there are other vehicles that can actually be introduced to you, including adenovirus. I think AstraZeneca is an adenovirus thing, but there's different things that carry the protein, if you will, or the thing that goes inside of you. And I'll say messenger RNA, mRNA, right? So it goes in. Then the body says, okay, there's something that's here that looks a little bit different. Let me turn on a group of cells that sort of will basically then begin to sort of say, well, this thing is different. So then what happens is then when you get the second vaccine, right, or whatever vaccine you're going to get, if it's flu or whatever, right, then your body then turns on and responds. The reason why you get the headache and you may get the aches and the chills is that your body basically is beginning to respond to what it looks like. So then when you get confronted with the vaccine, right, when you get confronted with the virus, here comes the virus into you, right? You get attacked by the virus, right? And what happens is your body then says, I'm going to turn on these antibodies, and these antibodies are going to kill the virus, and we're going to kill the sucker, right? So basically, that's kind of how the vaccines work, right? You go in your body, it goes in your body sort of gets turned on. It turns on your immune system so that when you actually get the real virus coming at you, right, then it can fight it off, and you won't get it. You won't get it.
Mm.
Thanks for
You
that.
won't get it.
What does
That's kind of the response to that. That's how all vaccines work, right?
What about the new variants we're hearing about? What do they mean for the currently developed vaccines, the ones that are already out?
Yeah. So currently, right, from what I heard within the last 24 to 40 hours, because every day there's new stuff. Actually, they found out yesterday. I was looking at there's a California variant that they found in November, right? So you're going to have to. So let me explain this. So in Europe, they do a lot of genotyping, where they basically identify the virus in somebody and they test it, and they've done that thousands and thousands and thousands of times, right? So they've done it way more than we have. We've only done it, if you look at, they may have done it 100,000 times, we may have done it 5,000 times. So they know that there's more variants in England than we know about the variants here, because we've not been testing the DNA. I mean, we've not been testing the virus to see what the virus looks like, right? Because it's normal for there to be variants. So right now, the vaccines, both the Moderna and the Pfizer, right, are active against the variants that we know about, right? That is like now everybody's suspicious. Well, maybe it's not. But let's get the vaccine, and then we'll worry about that. Because if enough people get vaccinated, right, then we won't have to worry about any of this thing, right? And that's really the key to getting out of it, right? Again, it goes back. The more people get vaccinated, is the quicker we get out of where we're in right now.
Doc, I got a
So to
couple
answer
more
your
if it's okay.
Oh, go
the
ahead.
vaccine,
Go ahead, Dr. Campbell. Sorry.
vaccines work against the new variants that have been identified as far as we know as of today.
Okay.
How concerned should people be about bad reactions or side effects in general?
So bad reactions. So the numbers are, it's very unusual to get a bad reaction, right? And every so often they say that. So it is estimated that and they're kind of now going to start getting to these numbers. 1 in 100,000 people may have a reaction
Cool.
to one of the Pfizer thing. The reaction could be like it could be a fever, or it could be something else like that. And 1 in 400,000 on Moderna, right? So it's pretty rare that it happens. I don't know what the number is for the flu vaccine, but there are reactions to the flu vaccine also, right? So that number is pretty low, right? That's if you're gonna vaccinate, that means like you vaccinate 1 million people, that 10 people may have a minor reaction to it. It's pretty small. It's not that many people.
Are there groups of people who don't need or shouldn't get the vaccine? And what about pregnant women?
So I was actually operating with a nurse who's pregnant, and she was looking forward to getting her vaccine
Mhm.
on Monday. So they're now recommending it for people who are pregnant who should take it, because then she takes and her baby's got it too. So that's a good thing. So they're recommending it for pregnant women. Now, at first, they were not recommending it for immune suppressed people, but I think they're beginning to sort of change their mind about that, right? Because as you get more experience with it, then you'll know if there's any problems with it, and we're getting more experience with it.
And lastly, these are the kind of questions I hear from folks. So I'm gonna try to say them just like I hear them, and you can respond. I'm hesitant to get vaccinated. I don't get the flu shot. Do I really need to do this? What would you say to that? How would you answer that?
So let me just tell you something. So everybody says you should get the flu shot, don't get it, and okay. So 22,000 people die a year from the flu in the United States, right? Right. That's roughly the number. In the first 3 weeks of January, right, 22,000 people have died from COVID, right? We have 4,000 people dying a day from COVID. Well, that was happening with the flu, right? Right. This is not the flu, right? And you have to understand that when you get this thing, this is the problem: is that if 100 people get it, you know, some people are asymptomatic, and you don't know if you're asymptomatic or not, and you don't know if you have it. So that's one group of people. Then there's a group of people who get hospitalized, and that's that roughly 15% or so. And then there's going to be people who are going to die, and that's in probably the 1 to 2%. But then there's a bunch of people who are these called long haulers. That's people
Mhm.
who basically they're weak for months, right? They don't have the right strength. They can't taste things. I mean, their neurological function. They have COVID brain or some variant where they have cognitive problems related to that. This is something you don't want to get, right?
Hmm.
Right. I mean, you don't want to get the flu, right? But you definitely don't want to get this, because this is way
Hmm.
worse.
Mhm.
Right? There's a thing. It's just like this is not like the flu. This is way worse. And to get
Hmm.
this, you can die. And the problem is, I can't tell you if you're going to be the person who's going to die or not. Right? I can't. I don't know that. Right? So if I knew that, that would be very helpful, right? But the problem is, I don't know. I know that if you have comorbidities, right? If you're over a certain age, right, you have greater chance to get it. Certainly, if you're black, you have 2 to 3 times a chance of getting, 4 times a chance of going to the hospital, 2 or 3 times a chance of dying, right, than anyone else. So if you're African American, Latinx, or Native American, you have a higher chance of getting major complications, right? So we have to just sort of say that so COVID, there's disparities in outcomes for a lot of different things. That includes cancer, that includes trauma, that includes a lot of different things. So people of color, right, have different outcomes, and are worse outcomes than other folks. And what COVID has done, it has just brought this whole thing out against the disparities in care and
And
outcomes.
lastly,
And that's just what this is.
Okay, sorry about that. Didn't mean to cut you off. My
Oh, go
last
ahead.
question is: if someone's already had COVID, do they need to be vaccinated? Should they be vaccinated?
Yeah, you can get it again. And you have to wait a certain time for it to recover, right? But you have to get it because there's about 15 people in the world who've gotten it a second time, and some of those people died. So this thing is an evil thing, right? This is bad. This is just bad. You don't want it. You don't want any parts of this, right?
Mm.
Right? You don't want any parts of it, right? You definitely do not want any parts of this thing at all, right? You want to take the vaccine, get your antibodies, be careful, and then continue doing what you're doing, right? That's what you want, right? That's what you want to do.
Thank you.
Doc, you want to take a drink of water or something? You've been going. Ooh, because you've been
That's right.
rapid
Malcolm
fire with
he was
this.
putting it down. Malcolm was like, "Yeah, I got this for you."
People want to know. I know so many people. Obviously, I know a lot of people. It's funny. I did an informal poll on my social media. All the
Yep.
moms are like, "Yes, I'm taking it." All the women, mostly women, and the mothers.
And the brothers were the hard heads.
There was, but there are a number of people who just have already made a hard no, or
That's
they're
right.
gonna have to be convinced. And
That's
I
right. That's why we
I
have
hear
to
from a
talk
lot of
about
those people.
it. Yeah, we have to make sure we talk about it because in order to get to people, we have to let them know what's going on. I mean, there was a big push among social media, and I'm a little bit on Twitter. So actually, when I got the shot, I took a video of it and I posted it, and I had about 20,000 people look at it, right? Because I just want to make sure people know that this thing is safe and that you're going to be okay. And then I said, week out, I'm fine. 2 weeks out, I'm doing fine. I got the second shot, everything's okay. Because people need to see that
I
this
think
thing
that's
is safe,
important.
and we got to do it because this role modeling is a thing that we got to do, right? We got to make sure that people know that this is okay, right? It's okay to do it. Yeah, you know what? The biggest thing I felt relief. I felt sorry that look, when you looked at Joe Biden the night before with President Biden, Vice President Kamala Harris, like out in front of a reflecting pool with 400 lights, with 400,000 people. That's just terrible. 400,000 people are dead. That's mothers, brothers, sisters, brothers. I mean, and they're black people and people of color, a lot of them, right? And this is just terrible, right? So we have to put our game face on. This is a war. We got to go to war with this virus, and this is part of our tools with the war.
And you have some questions in the chat, I believe, or comments in the chat, and that'll be interesting to hear the comments as much as the questions.
Yep.
Yes. I mean, it's wonderful that people are talking and are very interested. One of the questions, well, one, Stefan just shared that he knows somebody who got COVID a second time and passed. So that just really helps to,
That's
yes, get the
right.
vaccine. Shawnee asked, Shawnee and Nisi are in the chat room, so it's good to see both of you as well. But Shawnee asked, what about people who have food allergies? So I think that's a concern for her. And Nisi would like to know your top reasons for why we should get the vaccine, because she says, the Black community are afraid of the side effects.
That's right.
And then,
One at a time.
Yeah.
Let me answer one at a time. Start with the food allergy.
So the food allergy thing, as far as I know, there's been no problems with people with food allergies taking the vaccine, right? Right, number one. Number two is, what are the top reasons to get the vaccine? Is that what they want?
Yeah.
What are the top reasons? The top reasons, because you don't want to get this thing. Number one, you don't want to get it. You don't want to die from it. You don't want to get sick from it. You don't want any parts of this thing. And we're still trying to understand them, the things that go along with this virus. You get blood clots associated with it, so you can have strokes, you can have heart attacks, you can have pulmonary emboli, you can have clots in your legs, right? There's kids that get this inflammatory syndrome and they get sick from it. I mean, there's people who get weak and they can't do all the things they have to do. Not to mention the biggest target of everything is the lungs. The lungs are the biggest problem because some people, when that reaction gets turned on your lungs, that's what kills you, right? And that's what people end up coming to the hospital because they can't breathe. right? And that's a terrible death when you can't breathe and you die because of that. And the other thing is that these 470,000 people, they're dying alone, right? Because when you have COVID, nobody could come and see you. So that means that I'm saying goodbye to you, my mother, brother, sister, cousin, whatever, by FaceTime, right? So, I mean, so you look in your phone, right? You get on FaceTime, and that's how you say goodbye. It's not how people die in the past in a hospital, right? Because I've seen a lot of people die because of what I do and what I work. I'm an intensive care unit doctor, so I take care of sick people a lot, right? So I've seen people die, right? And usually their families with them, and we can counsel them, and they could be with them, and we could say a prayer. They can take care of the spiritual needs. You can't do that with COVID, right? It's the doctor or the nurse in there with your mother, brother, sister, aunt, cousin dying, and you can't be with them because you spread the infection. Now this whole family's coming in now with COVID, right? They go home, they give it to their mother. I mean, I've heard these terrible stories of kids going home and their mother and father going to the hospital and dying of COVID, and they're on the phone saying, "I'm sorry I gave you COVID," right? Because I gave it to them, right? Because you got to. That's why you're doing a social distance and you have your home pod. The only time I take off my mask like I am now is when I'm at home, right? When I walk out the door, the mask goes on, right? In my car, I don't wear a mask because I'm in there by myself, right? But when as soon as I get out the car, I got the mask on. I'm going about my business. When I work at work, because I get exposed to COVID patients all the time, I just assume that you got COVID. I don't want to get it, so I actually wear 2 masks and a face shield, right? So when I walk around, I was doing rounds last week with the residents. I said, because we have emergencies that come in, a lot of them come back COVID positive, and so I operate on you, you're COVID positive, but if I basically I'm protected, then I've not been exposed. So I make sure everybody I work with is protected.
What's interesting, it's probably not a good word, but here you have a community that's at greater risk for COVID, that might be more reluctant, for many of them are more reluctant to take the vaccine. That dynamic is just fascinating. And they have good reasons they feel for not, taking it. It's almost like the pathway, to health is right here. All you got to do is walk through it. And it's gonna. I decided. I'm taking it. I said that from the beginning. I'm taking it because I don't want COVID. But it's an individual decision for me, and it was crystal clear for me. And I knew all the history. I know every experiment that's been used on us. But I don't want COVID, right? And so prevention is one thing, but possible. And I know immunity is a tough word because you can still get the flu even though you take the vaccine. But getting to the points where you don't have to worry like that, it seems to me to be, for me, a great relief. And I have had people who have taken it and they're fine. I guess it's really an individual decision, but the individual decision also impacts the greater group. Because if we can get to what they call herd immunity, then we got it. So yeah, if people have concerns, Doc, I was thinking about you because you're the same. Here you are saying it's safe, and you just said it's safe. Boom, boom. You didn't mix words, safe. You're the same guy that when people get shot up in the community, they bring them to you, right? You're the same doctor. You're the one that goes in there and you're stitching them up, and they're saying, Dr. Campbell, please save my son, please save my daughter, do what you can. You're the same guy. And for me, for me, if you say it's safe, I have the same thing as saying, I have the same reaction to you saying, you're a skilled surgeon. I know you'll take so yeah, I'm going to offer an article, and then maybe just put out more things for more people to read. This is an article actually that Malcolm sent me. and it's from Health and Technology. Looks like it was 122, 2021. And this doctor's name is Dr. Eugenia South. And she says, I'm a Black doctor who didn't trust the COVID vaccine. She's a doctor, right? Here's what changed my mind. It's really good reading because she was a Black doctor and she did not trust it. And it's a picture of her actually getting the COVID vaccine, you know, if you can see that. But for all the reasons that a lot of people had, she was worried. And she said it was interesting because she says, I was decidedly and definitely against being among the first to get the shot. Instead, I plan to wait and see how others did with the vaccine. I suppose I am wary of the very system to which I have dedicated nearly 2 decades of my career. So for her, it was like, I'm a doctor, but I, you know, and so, and she says, to be clear, I'm not a vaccine skeptic, but she had doubts about the speed of the vaccine at that time. And she was worried about being a political tool, like you said. But then she said, here's what helped change my mind. And I like what she said. First, I had to educate myself about how the vaccine had been created. So a number of the questions that we've already talked about, she went and educated herself. I love Malcolm X's quote, find out for yourself. That was one of the bunch of quotes he had. You know, so find out for yourself. So she went and found out for herself and was satisfied that no, it passed all the clinical trials and had been worked on by a Black woman, right? She also read the experiences of people of color and trusted Black physicians who participated in the vaccine trials. Now in the trials, there were a lot of us in the trials, unlike in the past where sometimes we hadn't been. She says, reading their thought processes, how they weighed the risks and benefits, and what their symptoms were after the second dose helped me to envision taking the vaccine. So she had to go through a process. She went through the process. And third, this is interesting. This is not part of the scientific process. She said, third, she says, my mom begged me to take it. She said, since March, she's been hearing terrifying stories about COVID patients. So at the urging of her mom, that clinched it for her. Still, she was undecided. And in the end, she weighed all of this against the risks of, how does she say it? Contracting coronavirus. And then the choice became clear. And I like that word. It became clear to her. And it seems for a lot of us, it's going to have to become pretty clear. And she would get the vaccine. She talked about she did have some reaction. She said after her second shot, not for the first one. She had some after the second one, and she's fine. And now, with confidence, she can recommend to all of her people that she comes in contact with in a health capacity, but do your own research. So I'll submit that to people. You can look for it it's under Health and Technology, Dr. Eugenia, and she's a sister, Dr. Eugenia South. And that's another person other than, people that who have had this experience, people just like us. Lady Estelle.
Yes, Dr. Campbell, what do you have to say about the vaccine being taken by people who have pre-existing conditions?
So what do you mean?
Heart disease, high blood pressure.
Oh, they had enough people in the study who had those things that actually made sure it was safe.
Diabetic.
There's a lot of people who had those things who were in the study, and there's no issue with that. So if you have a pre-existing condition, it is safe to do that. So the things that I was concerned about first was, okay, if you have advanced cancer, should you take it? And I think now that we've had 20 million people vaccinated and we're not having problems, it's basically, I think it's probably going to be safe, for those folks. So, I mean, it's safe for pregnant women, right? So I think the next group is, and a lot of folks, remember, if you're over 65 in your nursing home, and those are the groups that are getting vaccinated, you have all these pre-existing conditions, or you have a lot of them, right? And it's been safe in those groups of people. So I don't think there's a problem with that. It just, I think that we wanted to have some experience where large numbers of people. So let's say if 20 people have gotten it, as of today, the first shot, and we're not hearing about, major problems, I think it's going to be safe. And because as we get more, there'll be more. There're going to be some small reactions that people are going to have, and that's the fever and the headaches and the muscle aches and all that stuff. I didn't get any of that stuff. I got a
So,
sore
but
arm.
the fever, the muscle aches, and the headaches, those are COVID symptoms. Is that right?
Yeah, those are symptoms of you responding to the vaccine. That means your body's like, hey, there's something coming in here that I'm like, and I'm being turned on, right? Right. So that's actually a good thing that it's happening. So it's usually after the second shot. So people I know, not me, right, who had the reaction, they had it after the second shot, right? So some of them felt tired, so fatigue, muscle ache, headache, but that's a very small number of people. So, and that's expected. You can get that after you get the flu shot. So that's not, I don't think that's anything dangerous.
Okay.
And you can take a little Tylenol, and that's okay. Tylenol is the wonder drug that works wonders. Take a little Tylenol, and you're fine, right? So that's okay.
All right, Dr. Campbell. Thank you. Thank you.
You only have one question, Estelle. You always have many questions for me. That's
I
all
know.
you got.
I know. I have a lot to say. So whenever I have a lot to say, then I find myself just kind of sitting quiet and listening and taking in the information because there's a possibility that my questions will be answered, as I listen and gather the information. I know how I feel about getting the flu shot. My doctor will call me up and say, you need to get in here and get your flu shot. That's how I am. They've got to come. I will set up an appointment for you. And then if that doesn't work, then she'll call me in for something else. And then while I'm there for that, she'll say, oh, by the way. Okay, that's how they have to get me. Otherwise, so this whole thing is like, oh my goodness. Oh my goodness. So I'm really listening to what you're saying. The article that Dr. Marshall was sharing, one of the things he said was she was a doctor. And the fact that he said she was a doctor make me think, does that mean she dead? She didn't make it? If she was, then what is she now? What's happening? And
she posts
information
she
that's
posts on social media like I do. So she'll she did really great, so with that. But we have to be messages. We have to make sure that people understand. And there's some things I was saying in social media just to make sure that people know. I mean, we're kind of really in this battle, and this is just the fact that we got it within 10 months of the virus hitting that's remarkable.
That is remarkable. And the other thing that just kind of stays with me is we've been lied to for 4 years.
Mm-hmm.
That's right.
And then we end up in this pandemic, and the lies continue. And then now we've got a vaccine, we've got a vaccination. It's like you got to know what's true. After being lied to for 4 years, you're like, is this the real story, or is this another lie?
Well, I think the person who told the truth through all this, even though he had to struggle, was Anthony Fauci.
Yeah. So I appreciate what you're saying.
Right.
Fauci said it was okay, and and he did. Right. Then I said it would be okay to do it because I was worried about the politics too. I mean, because 30,000 lies in 4 years. I mean, 30,000 lies the president told within 4 years. I mean, the lying number after he got banned from Twitter, the lying number went down like significantly, right? So the lies have gone down, but people got to know who they can trust, and that's what kind of all this craziness is about. I mean, you got to know who you can trust, and if you can trust him to sort of right, this is what's going on. He's a pretty straight shooter. He's a Brooklyn-born guy, and I'm from Queens, so I'm like, okay, if that guy says that, even though he's from Brooklyn.
Now, you also mentioned the Johnson & Johnson vaccination. Yes. And you said that's a one shot. Moderna and Pfizer, 2 shots.
2 shots, yeah.
And Johnson
two
and Johnson
shots.
is one shot. And
Right.
then I understand that Howard University was withholding or waiting to on a vaccination that they felt would be more conducive to people of color. So with all of that, and then I don't know if this Johnson and Johnson is that vaccination that they were speaking about. So what can you say about that?
Well, I think it's something separate. So the ones that there are 5 vaccines being developed right
Okay.
now. 2 are out. Johnson Johnson within the next 3 to 4 weeks, the FDA is going to have that meeting and decide if it's safe or not. And they're going to, if they roll it out, because if they can roll that out, then there'll be the 3 vaccines. The fourth one is AstraZeneca, and that's what they're giving out in Europe, right? That's what's going in. That's what's in England, right? So those are the different types of vaccines. But you got to realize, I mean, there are 4 billion people in the world, right? And if we're going to do something like, eliminate things like, think about, we eliminated smallpox from the earth, right?
Right.
Because it was such a terrible thing, right? And we just have to eliminate this thing, and it's just going to take time, for us to get to things, because in the poorer countries, there are problems, but we have, we have 25 million cases, and India is the second most common, second place, and I think India has something like 10 to 12 million cases. I mean, we're way ahead of everybody else. It's because we've had this war on the truth that's going on, and everybody's just not listening to each other, and everybody's like, oh yeah,
Right.
in your face, do it. I mean, look at what was happening. So when the Capitol was attacked, and I heard some of the stuff you guys were talking about, the insurrection of the Capitol, right? So they said today 30 police officers who were trying to save people's lives got infected with COVID, dealing with all these thousands of people coming in without masks, right? 4 or 5 of the representatives got infected with COVID because they were downstairs with people. When people were trying to give them a mask, and it's like, I'm like walking a room, I'm like, please take this mask. They're like, no, I'm not going to do that. And of course they get infected with the thing, right? And this is ridiculous, right? This is like, come on, we're together, we're close together. We can develop an infection. Like, let's protect each other, right? And do it that way. And that was something that was incredible that they would that was going on. So police officers at the Capitol trying to save lives, they got it, and now the police officers got it, and then the members of Congress got it too. So this is just unbelievable.
It's unbelievable.
Kind of it's so crazy.
It's unbelievable.
Doc, I guess you were, from the macro perspective, and it's not even macro because it's people, it's human beings, that we are rejoining the World Health Organization because I could not understand. I mean, there's so much I couldn't understand that this, I don't want to curse on the air, person did, and a person is a hard word for me to use, but a disease that's affecting a disease that's affecting the planet, not to coordinate it with everybody, not just in the development of the vaccine, and also, getting the vaccine out and the distribution of the vaccine. Just nuts. That's all I can say is nuts. So I know you feel good about that because now you can,
global economy, people fly around all over the place, and we need a global approach to this thing. And
Right.
it never made sense to me that we would back off from the World Health Organization, right, in the middle of a pandemic, right?
Right.
That doesn't make
in the middle of it.
In the middle of a pandemic where we need all hands on deck, we're going to back off this thing, which that never makes sense.
And lie, calling it a hoax when people are dying like crazy. It's like, so it really has an impact on you after a while. You just kind of have to wait and see. But I really appreciate your voice, your experience, and that, like my cousin, my sister got the Moderna, and he said, okay, I'm gonna check back to make sure you're not chasing cars, but
So there's a lot of science fiction stuff with all that, everybody's.
But she got the second shot and she's fine. She's fine. So, but I do appreciate your expertise.
Stuff, I Am Legend and all this other stuff. Everybody has got. It all starts with a crazy vaccine that takes over the world. So everybody's like, well, how could this be safe and all this other stuff. But we have to. This is sort of something that was scientifically developed, and we think, so far everything looks like it's safe and it is reasonable, and it'll get us through this. And we have to just get through this because it is. Otherwise, it's gonna, we're gonna be doing this for a long time, and we want to get through this as quickly
We
as
want to
possible.
get through it.
If we get
We-
through it,
Certainly would like to get our kids back in school,
well,
among other
because,
things.
the other thing that's interesting, and I think you probably talked about this, is that the impact on different groups of people are tremendous because kids are getting behind in school big time.
Yeah,
Whether or not they're in grade school, middle school, high school. Now, the college kids can probably make by okay because they can do Zoom, but you think about the impact it's going to have is on and people of color. I mean,
yeah,
the impact is huge. Since we're
yeah.
already struggling to sort of keep up with kids who are in the grades 1, 2, 3, 4, 5, and so forth. It's going to be a major setback. I mean, there's a whole generation of kids who are going to be impacted for that. And yeah, we have to close restaurants and bars to keep the schools open. We should do that, right?
Right.
To do that, if we can get to the point where things can be open safely, that's fine. But there are a lot of people being tremendously affected. Couples that both parents are working, they can't go to work. One can't go to work because they got to do childcare. I mean, there's a major impact
It
of
is.
kind of what's going on.
It is. It's horrible.
It's
And
a major.
have we answered every question in the chat? We want to leave no stone unturned, and I want to make sure if somebody say, "I came on and you didn't answer my question." So,
Yeah, well, people are sharing, and Shawnee shared, and I remember when this happened, and her brother passed from it, and that was just a really sad story, and for me, it made it really real because it was here in Vallejo, but she said she also got COVID, but she's still scared to get the vaccine, and I definitely understand that. Nisi is sharing, is the vaccine safe for people who are allergic to eggs? And were they able to make adjustments to that? And
Yes,
then,
it is safe for that. Yeah,
yeah,
it is
and then another one is, do we have to get it every year, or is it going to mutate just like the flu?
Yeah, that's a good question. I think there's not enough data to say that we'll need to get it every year, but I think let's get it into the arms. Let's get the vaccine in the arms of all the people who can get it. Now, I want to dispel rumor that people may have heard. So I know that um, that people have actually got the vaccine and they actually end up getting COVID and dying afterwards, right? So just so it's very clear, is that the vaccine does not cause you to die from COVID, right? That is wrong. That is not a fact. That is not a truth. So what has happened is if you get it after you get the first vaccine, right, you don't have enough. Your immune system has not responded enough to basically mount a fight against it, and that's where you got it. So some of the representatives in the House of Representatives who got infected during the siege on the Capitol, right, they had gotten the first vaccine, but the thing is their body did not get a chance to respond to it because they say that after about 3 to 4 weeks after the second shot, that's when you start, developing a robust response to the virus if you get exposed to it. That's really where it works out there. So you need. So if you take, let's say the Pfizer vaccine, take one, and 3 weeks later you take a second one, you're talking about a month later. That's when you're going to start getting protection for a period of time for the vaccine. And we just need to get you protected until we get to this, 70% rule or 80% rule of the population getting vaccinated.
and even after you, I want to make sure I get this clear too. Even after you've had the vaccine, still wear the mask, still social
That's right.
distance, still observe all the protocols. Is that correct?
That's right. So people have said, I mean, there's some other. So just so you know, so Rand Paul, who's a senator, right, said he's going to take it. He's also a doctor, but he's an ophthalmologist who's not board certified and doesn't practice. So I'll just sort of say that. So I'll take that with a grain of salt, right? So he has said, I'm going to take off my mask 3 weeks later, with that. But the reality is, do not do that, right? It does give you a lower protection, but you still need to wear the mask, wash your hands, social distance until people get it, because you can still get it and pass it on to someone else asymptomatic and kill your mother, right? Or kill your father, kill your brother, right? And that's what you don't want to do, right? So you have to really recognize that like this is a thing where we have to look out for each other when we're doing this. So even after you get it, you still have to wear the mask, and that's going to be indefinite. And everybody who does this all the time, we say this is what you have to do with this one.
Well, the last person I'm listening to is Rand Paul, but about a bunch of things, and certainly about a medical condition. I'm listening to Dr. Fauci. I'm listening to Dr. Campbell. Because y'all know what y'all talking about. This has been wonderful, man. This is incredible. Again, Doc, you're the godsend to the, to the community, to us, and all the work that you do. And we need, this is, I can just say that, from when I've been seeing you in the hospital and dealing with them kids and, things you do and saving everybody's life from this. And again, that when doctors take this oath to save people's lives, that's it. And just thank you for spending this time with us. I told a lot of folks said if Dr. Campbell says it, he's all, just thank you.
So I'm going to give a shout out to my sister who is listening. She's in Kansas City, and she put in the chat that she's taking both shots and she'd be willing to take them every year. Bless her heart. What else did she say, Ann? I know she's watching.
She'll take it every year as she does the flu shot, and she was blessed to have no trouble whatsoever.
That's good.
Go ahead, sis. All right. I think we've been definitive. Dr. Campbell says it's safe. Do your own research. He gave you a couple articles, but we can beat this thing. The tool is out there, and we want everybody to stay alive and free and COVID free. So thank you. Thanks, Doc. Thanks
Dr.
again.
Campbell,
Thank you so much for having
I
me.
appreciate
We
you.
love you, man. We love you.
Thank you.
All right, bro.
Thank you so much for
Thank
having me.
you.
I appreciate
Okay.
that.
We'll check on it down the line. All right. Bye-bye, everybody. Good night. Stay alive and free. See you next week right here.
All right. Good night.
Okay.